Eyewitness News. This is breaking news.
Governor Raimondo about to start her daily briefing live at the State House. Let's listen in.
Outside today and breathe a breath of fresh air. For those of you who tune in every day at 1 o'clock, thank you. I continue to recommend that you keep yourselves as informed as possible. There's more information every day about the virus, and this is the best place to get information that's accurate and timely around coronavirus here in the state of Rhode Island. Today we're here at 1 o'clock. Tomorrow's press conference will be at 2:30, and then we'll return to the 1 o'clock hour for the rest of the week and through the weekend. Today I'm very sad to report another 7 deaths as a result of coronavirus here in the state of Rhode Island, bringing us to a total now of 80 deaths. We have 275 new cases of coronavirus in Rhode Island, bringing us to a total of 3,251, and we have 213 people in the hospital. And again, you can expect those numbers to continue to rise rapidly. We are now testing well over 2,000 people a day, so we're going to have a lot more positives. And also, we have widespread community transmission now, so we're really climbing up the curve, and I don't want you to be alarmed when you hear these numbers increasing. I do want you to maintain your vigilance. The stay-at-home order is still in effect. It's getting old now. I realize that. It's a critical time right now that we can put a thumb on the scale of stopping this virus. So even though we're tired of being cooped up and obeying the stay-at-home order, I'm asking you please to double down and continue to abide by the social distancing requirements. To that end, recently I've received a lot of questions about whether we should be wearing masks at all times when we're outside of our house. And last week, Dr. Nicole Alexander Scott recommended that we all wear masks, homemade or purchased cloth face masks to cover our nose and our mouth. The answer is yes, that is what we should all be doing. These masks will not prevent you from getting the virus, but evidence suggests that if you wear a face mask, it could reduce your ability of spreading the disease to somebody else. And that's just as true inside as outside. Last week I started to get an awful lot of questions from people around why we weren't requiring retail business employees and the like to wear the face mask. And so I'm reporting now that earlier today I signed an executive order making our direction clearer. And I'd like to take a second to review that executive order and clarify our guidance. Beginning this Saturday, all employees of customer-facing businesses, office-based businesses, manufacturers, and nonprofits must wear cloth face coverings when they are at work. I signed the executive order today. It does not go into effect until Saturday because I realize that employers are going to need a little bit of time to prepare, so you have the rest of the week to prepare. But as of Saturday, it is the law in Rhode Island that all employees in these businesses must wear a cloth face covering while they are at work. Furthermore, all of these businesses must provide face coverings for their employees. Face coverings can include scarves, bandanas, and other homemade and non-factory made masks. So if you're an employee and you have a mask or you want to wear a scarf, fine, but if you don't or you can't, your employer must provide you with a face cloth covering. Additionally, all customer-facing businesses must take steps to remind customers to wear face coverings. That means they should be putting up signs at the door, reminding customers to wear a face covering inside. The only exceptions from these rules are for anyone whose health would be in jeopardy because of wearing a face covering or any children under 2 years old. By the way, I would say that if you're somebody whose health would be in jeopardy by wearing a face mask, you shouldn't be outside. you have an underlying health condition, and you should absolutely be staying home and getting a hand from somebody else to deliver your groceries or get whatever essentials you need. So this means, as of this Saturday, when you go to the grocery store, when you go to the pharmacy, when you're at work, you should be wearing a mask, and everyone in that store, employees and customers, should be wearing a mask. That's where we want to get to. Probably the first question on everyone's mind, and I'm sure the media will ask, what's the penalty if people don't do this? I would ask you to stop thinking that way. Stop thinking about what's going to happen to me if I don't follow the rules. The first question I want everyone asking is, okay, how can I obey that rule? Where can I get a mask? How can I get my employees masks? How can I make sure that I put up enough signs in my shop so that everyone who comes in knows they have to wear a mask? Let's all ask ourselves, what am I going to do between now and Saturday so that I can comply with this new executive order when it becomes official on Saturday? I'm also sure many of you are saying, I'm not going to do that. That's weird. It feels funny. I look stupid. I don't know if it helps anyway. And to you, I am saying you have to do this. You have to do it because it's going to protect everybody else in Rhode Island. I have a mask that I wear here in the office every day when I'm not giving a press conference. It's hard to give a press conference with a mask. It's simply made out of cloth. Brett does the same thing. Dr. Nicole does the same thing. And I will be the first to admit, it feels strange. This is not normal. It feels weird. It's hard to breathe. It's uncomfortable. But it's the right thing to do. And I have said so many times that I want to reopen the economy, and I do want to reopen the economy. And the new normal of, life at work in the months to come until we have a vaccine and good treatment is going to be a normal that involves wearing masks. So it's something that I need us all to get used to because it will prevent each of us from spreading the disease to those around us. DBR will be doing spot checks on businesses, unannounced spot checks. So folks from the state will be, DBR and also the Department of Health, are going to be going around starting on Saturday to do spot checks on retail businesses, on all businesses that are open, just to make sure that the businesses are complying and that customers are complying. If after a week or so we see that there isn't enough compliance, I have also given DBR the authority to impose stricter regulations, fines, and penalties. But I haven't gone there yet because I'm confident that we're all going to do the right thing and get ourselves into a place where everybody can wear a mask. But as with all things, I will tighten the regulation and increase the penalty or add a penalty if we don't have compliance. If you are not sure how to make a mask or where to procure a mask, you could go to the Commerce website, commerce.ri.gov, and they have some pretty helpful videos and tips for how to get a mask, make a mask, or distribute masks to your employees. I will say, shutting down the entire economy as a way to deal with this crisis is a terrible thing to have done. It's my goal and desire to undo that as soon as is safely possible. And as I've said all along, I need to try to get to a place where we have a more targeted response. It's going to mean that when we start to go back to work, things will be different. And so this is a way of beginning the process of getting us all used to kind of life in the new normal, of going about our daily business with new rules. The final thing I'll say is this. I recognize we're going to be smart and thoughtful and cooperative as we impose these new rules. There are some businesses, call center businesses, for example, where your employees can't do their job if they're on the phone all day wearing a mask. I understand that. So we're going to work with you. If your employees can't wear a mask, they absolutely must be 6 feet away from everybody else, and there has to be proper cleaning protocol, disinfecting protocol, hand washing protocol. So I'm just beginning to share with you the way that we're going to have to move forward under the new normal in light of the coronavirus until we have effective treatment and a vaccine, which we know is many, many months to possibly a year or more away. Okay, on from masks, contact tracing is a critical piece of the puzzle here in order to be able to reopen the economy. Yesterday, I provided an update on the testing work stream, and I'm so proud of that team. All of our outdoor sites are reopened again today, bright and early this morning. They were all reopened. CVS is reopened, and I hope we do another 2,000 tests today. Great work. Today I want to give you a little bit of a glimpse into the work we're doing around contact tracing, where we've been, where we are, and where I hope to go. So to give you a flavor, over the course of this month, actually in the past 14 days, we've reached out to more than 2,800 people who've been in close contact with someone who has the virus. So that means we're reaching out to about 200 contacts a day, and in some days it's 400 or 500 contacts a day. In this regard, contact tracing, as with testing, Rhode Island is ahead of many other states. We have a team now, we have a team of nearly 100 people focused on nothing but contact tracing. They do everything from calling contacts to coordinating with counterparts across agencies. We've been able to successfully reach 3/4 of all contacts on our first attempt, and by the second attempt, that number goes up to nearly 90%. It is our goal to make it so that very soon people are allowed to have an electronic app where they're surveyed especially if they've been positive, they're in isolation. They'll be surveyed several times a day, each day, electronically about their symptoms. We'll have an ability to stay in touch with people. And it is our goal now, we're to be in touch with everyone who tests positive within hours, and we hope to get that from 10 hours to 6 hours to a few hours, be immediately in contact with folks who are positive, immediately in contact with those contacts, and then constantly in contact with the sick people every day. So it's been a Herculean effort by the Department of Health, now augmented by the National Guard. It is very manual and labor intensive, and they're doing a terrific job. This is a good opportunity for me to remind everybody that we all need to be writing in our contact tracing notebook every single day. I've seen some of your posts on social media. Good job. Some of you are sending me your contact tracing logs. Great work. I do it every single night. My team does it every night. You cannot remember who you were with a week ago. Even 2 days ago, you forget. And it's not enough to rely on your mental checklist. Just take a minute at the end of every day to write down who you were with physically, in person, and where you were. And also remember, you're supposed to be limiting your contact to the same 5 people. You shouldn't be interacting with 5 people on Monday, a different 5 people on Tuesday, and a different 5 people on Wednesday. So if at the end of the week you look at your contact tracing notebook and you see that you've had contact with 20, 30, 40 people, you're doing something wrong. That is not abiding by the stay-at-home order. Stay at home means stay at home. If you have to go to the grocery store, go quickly, go alone, come home, wash your hands. But please, if you get sick, if you're tested positive, and many, many, many of us will be, the very first thing that someone's going to ask you when they call you is, Tell me who you've been in contact with in the past couple of weeks. And I want you to pull out that contact tracing notebook and be able to tell them, here's where I've been and here's who I've been in contact with. Yesterday, I received some questions around evictions and utilities. I will say the worst part about this virus is the number of people who are experiencing serious economic hardship. And so I want to offer a few comments about eviction and utilities. We're doing everything we can, as you know, to ease the burden. I don't want any landlords out there threatening to evict people, threatening to shut off the utilities. You shouldn't be doing it. If you are, you're being a bad actor. But also, I want to give tenants some comfort to know that courts have delayed all non-essential business until May 17th. So even if your landlord gives you an eviction notice, and I really hope they don't, and if they do, I want you to call me, don't worry about it, because the courts are closed until May 17th. The same is true for utilities. The Public Utilities Commission yesterday voted to extend an order that all regulated utilities, which is electric, gas, water, and sewer, cannot be shut off or sent to a collection agency through May 8th. This applies to both residential and non-residential customers. So again, they can't shut off your utilities and they can't evict you. Having said all of that, if you are in a position to be able to pay your bills, please pay your bills. You know, landlords, folks who own real estate, they're having a tough time also. And so this is just the time to do the right thing for all of us. Like, don't try to sneak out from under the rules. Don't try to stiff your landlord if you're able to pay the rent. Don't threaten to evict somebody when you know you can't. Just do the right thing. If you can pay your bills, pay them. If you can pay your rent, pay it and do it on time. And by the way, the same thing goes for taxes. The tax deadline has been extended from April 15th to July 15th. But if you're in a position to be able to pay your taxes on time, I'd ask you to do it. Just do the right thing. The state needs help. I have to keep the lights on and continue providing life-saving services on behalf of the state. We need revenue to do that. So if you're a business or a family who can pay on time on April 15th this week, please go ahead and do it and know that we appreciate it. A final note about health insurance. You've heard me say so many times that nobody should go without health care. Nobody should have to choose between going to the grocery store or going to the doctor. That's always true. That is especially true now. We have to really make sure that every Rhode Islander has access to the health care they need and deserve. If you have lost your job and with that lost your health insurance, go ahead. You can go ahead to Health Source, our state-run exchange. You can purchase insurance. You may be eligible for Medicaid. I would encourage you to go to Health Source RI and see what might be available to you. To that point, we are extending our special enrollment period on Health Source RI through April 30th. It was April 15th. We're pushing back that deadline to April 30th to allow all Rhode Islanders to purchase coverage if you have had a change in coverage due to the coronavirus. I also want to remind everyone, Health Source offers a special enrollment period of 60 days for anyone who loses a job or changes jobs for any reason. That's any time. But right now, we have a special opening until April 30th. I would encourage you to take advantage of it if it's something that you need. So with that, I'll turn it over to Dr. Nicole and then come back to answer questions.
Thank you, Governor. Good afternoon. As usual, we'll start with data. The Governor shared our case count for today, which is 275 new cases. We've seen a decrease in the number of cases we've announced for the last few days. This has much more to do with variables like the holiday on Sunday and the weather yesterday, as opposed to a decrease in the amount of the disease we are testing for and evaluating in Rhode Island. We want to continue to encourage primary care providers. Thank you. Continue to accelerate getting as many people with symptoms tested as possible. And everyone still knows that they can go to cvs.com to also go online to get testing done as well if you have symptoms. So we will continue to be aggressive with capturing as many members of our population who have symptoms as possible, including those who are not able to make it to the drive-through sites and who live in various communities, either in the urban setting or are homebound. We definitely have you in mind or wanting to make sure that accessible testing is available for you as well. So to sadly go into a little bit more about the 7 fatalities that the governor referenced, there were 2 people in their 60s, 2 people in their 70s, and 3 people in their 80s. Our hearts and condolences go out to those families. Of these 7 people, 3 people were residents at nursing homes. In addition to these 3 people, there was 1 fatality which was associated with a residential home for people with differing abilities. This person was in their 70s. Sadly, that is the 2nd fatality associated with that facility for people with differing abilities. We've been asked a few times about why I sometimes name at the press conferences the facilities where we have seen fatalities and why we sometimes don't. We want to make it clear that we have that information, and upon asking, I can certainly share when we have clusters of cases or, unfortunately, clusters of deaths that have occurred at a particular facility. Oftentimes, with the timing of this press conference, we're looking to give the facilities and the associated families time to process, a very challenging situation. So that's why I have not been actively volunteering that information, really wanting to offer support for the facilities and the families involved. But for the media, we do have that information if asked, and we can also provide it in our press releases that are issued later in the evening to allow for some of that time to occur. Separately, as a follow-up to what the governor discussed about the masking executive order using cloth face coverings, I want to remind everyone that the cloth face coverings we are talking about need to cover the nose and the mouth. Your covering can be made of a variety of materials. It could be sewn by hand or improvised from household items such as scarves or t-shirts, or if you have a young baby with a bunch of clothing that has Velcro in it, you can use that in a creative way to make a mask. There are all types of possibilities to make face cloth coverings, with the point being to be able to cover your nose and your mouth, and have the primary role of this be to reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes. As the governor accurately stated, covering your nose and mouth helps to protect the people around you from being exposed. We are trying to limit the spread of respiratory droplets when people are in the community, when they're working, and when people are in public. These droplets that can be sprayed without a covering can oftentimes land on things, which is why we talk about the importance of being able to clean high-touch surfaces. Wearing a face cloth covering allows for less of that to be released into the environment. It's a good idea to wash your face cloth covering frequently, ideally after each use, and at a minimum, at least daily. It's also important to know, do not share your face cloth coverings with other people. Although this executive order is about customer-facing businesses, this same practice of wearing a face cloth covering is strongly recommended for all critical infrastructure workers. That includes law enforcement, people in manufacturing, people who work in water and wastewater infrastructures, and many others who are critical to the work that's occurring. Our executive order focuses on customer-facing businesses. I want to reiterate, if you want assistance as a business or as a staff person working there and getting support with face cloth coverings, you can go to the Commerce website. It is actually commerceri.com. So that is the updated version of that website that you can go to get the information. One other point I want to make on cloth face coverings is while they are very important, the governor has been great about emphasizing this. These coverings are not replacements for doing the evidence-based and proven social distancing that we're talking about, washing your hands regularly or using hand sanitizer, and absolutely staying home when you are sick. You should not be using a cloth face covering as a reason to go out into the community with symptoms. It is not acceptable and it's not effective to do that. These are critical prevention measures that must be done together, and the social distancing, the hand washing, and staying home if you're ill must continue. Lastly, I want to reiterate the message about not going to the doctor or going to the hospital without calling first. We have been partnering very closely with all of the hospitals and providers throughout the state. They have let us know that they are still seeing a lot of people showing up without calling at their facilities. They've also let us know that a sizable portion of those people are people who do not speak English. So we are working hard to get the word out. Again, with this messaging, we ask that you help us with that. We want to make sure it's available in English and in Spanish, and certainly be able to reach the other languages as well. People need to call their doctors if there is a concern before just showing up. Your doctors will help in determining whether or not a call to a hospital needs to be done. We want to make sure that people receive the care that they need, but we need to do it safely and help protect the healthcare workers who are on the front lines and our Rhode Island heroes out there taking care of patients every day. Another option for everyone to be aware of is the respiratory clinics that we have set up throughout Rhode Island. These are urgent care centers and primary care providers that have established a separate space specifically to see patients who may have COVID-19. They are equipped with the personal protective equipment that they need so that they can do it safely. There are roughly 20 respiratory clinics throughout the state of Rhode Island. So that's also an option for people to be able to call to set up an appointment. No one should be just showing up. We have a link to a list with phone numbers on our English and Spanish web pages for these respiratory clinics. The best thing to do is to go to our website, health.ri.gov, and you can either click on the COVID-19 banner that's on the front page and then click the testing tab, or you can click the En Español button on the health.ri.gov homepage, then look for testing or pruebas. Even for these places, anywhere that you go as a healthcare facility, provider, a respiratory clinic, an urgent care center, or the hospital, all of those places need a phone call before going, a phone call first, and not just showing up. With that, thank you, and we will get started with questions, which I shall take.
Good afternoon. And hello to everyone at home. We're going to start with Michael Bilo from Motif Magazine. Some preliminary research raises doubts whether recovered patients are immune or instead susceptible to reinfection or flare-up of residual infection. How does this figure into Rhode Island's planning, especially about ending social distancing and reopening the economy?
It's an excellent question. We had many policy discussions on that even just this morning because it's an ongoing learning as a country. We talk regularly with our federal partners, Centers for Disease Control and Prevention, other researchers throughout the country. Many of us are still learning what happens after someone has COVID-19. To what extent is someone immune to having future infections? How we are incorporating it into our approach is definitely the understanding that even if someone has had COVID-19, it is absolutely necessary to continue the social distancing requirements, the frequent hand washing requirements, and the staying home if you are ill again with anything else. That should absolutely occur. Definite key is that that should not change. We are working aggressively to better understand the serology or antibody tests that are out there, and we know that we cannot use just one mechanism to determine what works to open the economy. With the governor's guidance and thoughtfulness, we have many elements that are coming into play, and it will be one of several tools in our toolbox to help understand the best, the safest, and most effective way to move forward.
Our next question is for the governor from Matt Allen. Governor, you announced a partnership with other states in the region as a way to plan the reopening of the economy. Can you please expound upon what that partnership means in terms of obligations for the state? If faced with a decision that might be good for Rhode Island but not good for the other states, what is the direction you'll go in?
Thank you. So this will not involve any obligation for the state. This is I think of it as a working group. I've joined along with a half a dozen other governors in this region so we can coordinate our approaches to reopening the economy. I will always do what I think is right for Rhode Island. I will make decisions on the basis of what's happening in our state at that moment. And my guiding principle is, how can I get the most number of people back to work as quickly as possible, as safely as possible? And our economy looks a little bit different than those other economies, so I'm going to make the best decisions for Rhode Islanders. Having said that, on the 95 corridor, there's a huge amount of traffic. We share the Amtrak line. We share a lot of businesses. Certainly with us in Massachusetts, we have a lot of commuters. And so it makes sense that we coordinate and collaborate and learn from one another and have a joint approach. I'll also say none of us has ever done this before, and I mean none of us. So I haven't, none of the other governors hasn't, the federal administration hasn't. So I thought it was just the right thing to do, to have more smart people, more data, more guidance around this problem so we can learn from each other. It won't obligate us, but it's going to make sure we do a better job for Rhode Islanders.
Christian Winthrop of Newport Buzz asks, when you make the decision to start reopening the economy in Rhode Island, which sectors do you envision opening first? Which sectors will be among the last? What new rules do you anticipate for the restaurant industry?
Great question. So here's the way to think about it. As I've said a few times, there's not going to be a magic reopening, flip of the switch of the economy. It's not like we'll pick a date and everybody goes back to work. It's going to be incremental and targeted and industry specific, and there'll be new regulations per industry. Obviously, the industries that can come back online sooner are ones where they don't rely for their business model on lots of people being close together in small areas. Hospitality, restaurants, conventions, those are the businesses that will obviously take the longest to be back online. Regardless of the business, all of us are going to be living in a new normal, whether that means wearing a mask, working in shifts. Everybody should still be working from home whenever possible. We all need to start to realize that for the next year or so, we're going to be living under a new set of regulations. Again, my goal is most number of people back to work fastest at lowest risk. So we'll go industry by industry. How many people are out of work? How many people can we get back to work? What does that risk look like? And what are the regulations that have to be in place? And we're hard at work on it now. And when we roll it out, it's going to be a big, big change for everybody, but it's the only way we can get people back to work, which is, of course, the goal.
Richard Asnoff of Convergence RI asks, what kinds of coordination is happening with community health centers in regard to testing?
We have an entire team of people who are focused on accessing our vulnerable populations, as well as people in core communities who may not have the ability or the time to be able to travel out to the drive-through sites. We very much appreciate our partnerships with community health centers to be able to tap into the resources embedded in our communities. We are also working with our health equity zones, especially ones connected to our federally qualified health centers, where there is already a ready-made infrastructure designed to engage with members of the community who need assistance or who want to be able to access this resource. So work is being done to accelerate that so that we can make sure we are accessing every aspect of Rhode Island's population for the expanded testing approach that we've taken.
The next question is from Ian Donis. How many tests need to be done to make decisions on opening the economy, and when will the antibody testing begin?
Thank you, Ian. So I'll say this. I'm not sure we need to be doing very many more tests a day than we are now. So if we're at over 2,000, I'd like to get to 3,000. When you're doing 3,000 tests a day, every day, per million population, that is an excellent place to be. What we will look at is, how many positives do you have in a day? Is the rate of positives over a period of, say, 5 days going up, going down, or steady? How many hospitalizations do we have in a day or over the course of a week? Are we still, how long does it take for us to double our hospital population? We were at a place of doubling our hospitalizations every 4 days. So that is much too rapid. So the testing, numbers per day is in a great place. And we're going to continue, as Nicole said, we're going to do more in inner cities, more at nursing homes, more in congregate settings, but we're about where we need to be. With respect to the serology test, we are weeks away from that. We are right now in the process of figuring out which test to use. As Dr. Nicole said, you probably have to do more than one test for accuracy if you want to be able to rely on the test. And frankly, we have to try to get our hands on the tests. They will be easier to get a hold of than the reagents and testing equipment that we have now. But we are, 3-4 weeks or more away from having kind of widespread serology testing.
Next question is by Steph Machado of Channel 12. Yesterday's new Goldman Sachs loan program stopped taking applications before many small business owners even had a chance to hear of it. Clearly, there's a high demand and the federal loans are delayed. Is there another state program coming?
So thank you, Steph. Yesterday at this press conference, I announced a $10 million forgivable loan program from Goldman Sachs. And by the end of the day, it was depleted. We ran through the entire $10 million in a day. So I am, as you might expect, trying to expand that. I don't have anything to announce today. I'm working hard to see if we could convince Goldman to give more to Rhode Island. I'm also expecting the federal stimulus to be coming at some point soon. So the short answer is yes, I'm hard at work. I don't have anything more to say now. I do know that Congress, I have been told that there is bipartisan support in Congress and by the Trump administration for expanding the federal SBA payroll protection program. It hasn't happened yet, but I think relief will be on the way in that program as well.
Steve Alquist of Uprise, Rhode Island, says the George Wiley Center asked me to ask you if you are planning on issuing an executive order similar to the one recently passed by the governor of Michigan, allowing for the restoration of utilities without any down payment.
Yeah, it's something I might get to. Right now, there's no need for that because, as I just announced, utilities cannot, by action of the PUC, be turned off. So I feel good about where we are, and people should feel confident that their utilities can't be turned off.
Brian Amaral of the Providence Journal asks, you said 2 weeks ago that 5 million N95 masks and 3 million surgical masks were on the way to Rhode Island. Did they arrive? Are hospitals still facing possible PPE shortages?
Some have arrived, thankfully. Most have not. A lot of this is very complicated, getting them here from China, from all over the place, but many have arrived, so we're in much better shape than we were. Do hospitals have shortages? Not, for the most part, no. So on any given day, they can get through the day, they have what they need. The challenge is making sure that they have several weeks' supply on hand at any given time. We're also looking into better ways to sterilize masks. So yesterday, FEMA indicated that every state would be receiving equipment to do mass sterilization of masks, which allows us to safely reuse them. We're teaching clinicians and healthcare workers how to safely reuse the PPE. So I would say we don't have everything we need. I wish I could say we had 30 days supply on hand now, but it's not a crisis, and we are managing through it, and we certainly, everybody has what they need in the hospitals to do their job a day at a time.
WPRO's Steve Klampkin asks, do you agree with President Donald Trump's assertion that he will control when the states will reopen for business?
Look, I think the governors were the ones who had to make the tough decisions to close the economies of their states, and at the end of the day, we'll be the ones who make the tough decisions about reopening. We will do that in consultation with one another. We will do that in consultation with the White House. Most of all, we will do that on the basis of facts and science and evidence and what we know to be the right thing for our states. So I think you've seen governors lead through this, and I expect that that will continue.
Bill Bartholomew asked a similar question. Per President Trump's statement yesterday that he has total authority to reopen the economy, what is your administration's position on which level of government should have such authority?
Yeah, I think I just answered that.
Next question is by NBC 10 News. What do you think about President Trump? We're going to skip right ahead. Michelle Smith asks, what's your current goal for testing in Rhode Island, and what's preventing the state from reaching that goal? Vice President Pence and Dr. Birx said Monday there are millions of tests, but they are going unused because of a lack of coordination. Does that match your understanding?
Not here in Rhode Island. I was on the call when Dr. Birx and the Vice President said that, and that is, maybe that's the experience of other states. That is not the experience in Rhode Island. Also, as I said, here in Rhode Island, we're testing over 2,000 people a day. On a per capita basis, we're doing among the most testing of any state in the country. And again, great thanks to CVS. So there's more to do, and we have to get to hard-to-reach populations, and we certainly have to be doing a better job in our nursing homes and congregate care settings with mobile testing units. But the National Guard and CVS and the Department of Health, hospitals have gotten us into a good place on testing. The thing that I do need help with, and I need more help from the federal government with, is continuous supply of the reagents. So we have the equipment, and at the moment we have the reagents, but the supply of reagents is still a challenge. It's a challenge for hospitals here, and that's something that we just all have to struggle through.
Our last question for today is from Alan Gabberty of WBOB. He writes, there is a rumor going around that the Department of Health or the governor has banned the use of hydroxychloroquine to treat COVID-19. Could you clarify?
I can certainly clarify. We want hydroxychloroquine to be available to people who have COVID-19 in the appropriate situations where it is needed. I've shared previously that we coordinate very closely with our infectious disease providers as well as our critical care doctors. There are specific hospitalized situations where hydroxychloroquine is absolutely worth administering to see if that will help patients improve. We are fully in support of that happening. We want to make sure that hydroxychloroquine is used in the appropriate settings for COVID-19 and reserved for the previously FDA-approved reasons that hydroxychloroquine is used for, so that the patients who depend on it for their functioning and health still have access to that as well. So we want both paths available, both being done in the appropriate ways necessary for the patients.
Thank you, Doctor. Thanks, Governor. See you tomorrow.
All right, you've been listening live to the governor's daily briefing on this Tuesday afternoon, and we want to bring you, as always, some of the key highlights as we're tracking some of the developments from that briefing this afternoon. Another 7 deaths reported today. That brings our state's total down to 80 deaths in Rhode Island. And of these new fatalities, 2 people were in their 60s, 2 in their 70s, 3 in their 80s, and we understand 3 people were residents at nursing homes. 1 person was at a facility for people who have differing abilities. Our total number of cases now standing at 3,251, and there are currently 213 people in the hospital. Now, of note, this is probably one of the biggest headlines coming out of the briefing today. It's going to impact a lot of people, a lot of businesses. Governor Raimondo signing an executive order to mandate all employees of customer-facing businesses, manufacturers, offices, and nonprofit agencies to wear cloth face coverings while they're at work. This will go into effect this Saturday, and we'll be posting the details of that executive order on our website. Governor also went on to say that employers must provide those masks, and you're encouraged to wash the face cloth coverings after each use, and of course do not share them as well. We also learned that DBR will be conducting random checks. Also, court delays non-essential business until May the 17th. We also want to let you know that the governor is reminding tenants not to worry about eviction notices until then, and your utilities cannot be shut off. She did want to remind Rhode Islanders, if you can pay your bills, to please pay them in the meantime. She also announced that they'll be extending special enrollment on HealthSource RI until April the 30th. And health officials want to remind you, they're urging you to not go to a doctor or the hospital without making a call first. Governor also indicated she'd like to see 3,000 tests per day. Currently, we're at about 2,000 tests for COVID-19 per day as well. So again, a full recap on WPR.com. You'll be able to find the latest headlines, minute-by-minute updates throughout the day. And we want to thank you for joining us for this live briefing. We'll have a full recap as well tonight at 5.
Stay with Eyewitness News for the latest on this breaking story.